Hi, good afternoon. This is me Vandana PS from Needhu's Academy. Yes, another Friday, another reading live session. So how's your weekend? Do you have any plans for the weekend? Okay. So yes, OET is your priority, right? So definitely we have to do some additional materials every day. So you have a Saturday and Sunday, so definitely it's very important to do additional materials every day. Okay, so as usual, today we are going to deal with a sample question from part B. Then we will deal with part A. Okay, so first of all, I'll give you 2 minutes for the preparation of the question. Then we will look into the answer. So here is your question. All right, so the time is over. How is the question? So this is a memo. So this question is from the category, yes, third category. So this is again a memo, which means we are reading for the purpose. Okay, so I'll read the question first, then let's find out the answer. So either you can do this question in two ways. If you want, you can read the question first, then read the options, then read the paragraph, do elimination method and find out your answer. Or another method is read the question, then read the paragraph, then the options and find out the answer. It's up to you. Okay. So the question. The purpose of the memo about prostate cancer is to remind. So my keywords from the question. Purpose, then prostate, remind. So these are my keywords from the question. So what about you guys? What are your keywords from the question? Let me know in the comments. What are your keywords from the question? And why we are marking keywords from the question? Just to understand the question. Okay. So as you know, when you do part B, you will get only 10 to 12 minutes for the completion of 6 questions. So for the one question, roughly you will get 2 minutes. Okay. So yes, why we are marking keywords? Okay. So that keywords will lead you to find out the correct answer. So just to understand the question with this stipulated period of time, it's very important to mark the keywords, to highlight the keywords. Okay. Okay. So it's Mega. Your keyword is purpose, right? Okay. What about others? Okay. A lot of answers already. Yes. Hi, Suji. Yes. Hi. Good afternoon. Yes. Tessie. Mega. Yes. Jubi. Okay. Kirtu. Yes. Yogeshwari. Jansi. Reba. Okay. Vidya. Yes. Okay, so yes, we are moving to the options. First one, MRI and CT are the most desirable for early diagnosis. What about option B? There is no one method without any flu. And option C, higher blood antigen is the detrimental factor to cancer. So my keywords from the options, MRI, CT, then most desirable. So these are my keywords. And from option B, no one method. So no one method. And from option C, higher antigen, detrimental. So these are my keywords from these 3 options. And I'm reading the paragraph. Okay, so first of all, yes, this is from the 3rd category. It is memo. And we are reading for the purpose. Okay, so the title is prostate cancer. Modern medicine has made great strides in the fight against cancer, especially in finding improved ways to diagnose the disease. Then, not too long ago, many malignancies were diagnosed only after they grew large enough to make people seriously ill or produce a lump or mass that doctors could feel. Next, X-rays were used to detect smaller tumors, and now nuclear scans, CT scans, and MRIs can diagnose much smaller earlier growths, but as good as they are, these tools are not always good enough, so scientists are turning to biomarkers for even earlier diagnosis. Okay, so what about option A? Because we have find some keywords from option A in these lines. So what is mentioned here? So this paragraph is all about diagnosis of prostate cancer. We can use some techniques to find out or diagnose cancer, prostate cancer. So what are they? You can use X-rays, then nuclear scans, CT scans, MRIs. Okay, so these are best ways to find out the cancer. But still, what is the next line? But as good as they are, these tools are not always good. Okay, which means we can eliminate which option? Option A can be eliminated. Why? In option A, it is contradictory. What is mentioned here? MRI and CT are the most desirable. No. Okay, not most desirable. Why? Because these are not always good. Then what about the next one? So, scientists turning to biomarkers for even earlier diagnosis. So, for early diagnosis, it is not about MRI and CT. It's all about biomarkers. Okay, so we are eliminating option A. What about the next para? The prostate specific antigen, that is PSA, is a biomarker. So already in the previous line they have very clearly mentioned we are just moving to biomarkers for early diagnosis. And what about this PSA? A protein produced by prostate cancer cells that can be detected and measured in the man's blood. PSA testing is currently the best way to detect what? Prostate cancer, but it is imperfect. See, Another method is mentioned here, that is PSA. Even though it has advantages, what is mentioned here? It is imperfect. So that we can eliminate which one? Again, we can eliminate option C, because C is all about blood antigen test, right? So that is all about the PSA. So it is not a perfect method. So we are eliminating option C also. So the correct answer is, so these are contradictory options. Okay, I can say opposite options, option A and option C. Our answer is option B. What is option B? There is no one method, because as you know, this paragraph is all about two methods of identification or diagnosis of cancer. And either, okay, we can say no method is the best. No one method without any flaw. There is no one method without any imperfections. Okay, so that answer is option B. Clear? I hope it is clear for you, right? Yes. Okay. So a lot of answers. Purpose and prostate cancer, I choose. Okay. Yes. Okay, Mega. Okay, Kirth, okay. Elizabeth is good afternoon. Reshma, Drishya, hi. David, it is B. Reba, it is B. Suji, Kochu, okay. Elizabeth, it is B. Very good. It is the correct answer. Option B. Okay. So that's all. So what method, what strategy we are using here in part B? In part B and C, we are using elimination strategy or elimination method. Okay, so what is elimination method? To eliminate something, we have to read the paragraph. Okay, it is very easy in part B. There will be a question, I mean multiple choice questions with 3 answer options and the respective paragraph. So you can read it and identify your answer through elimination. Okay, so that's all about part B. And one more important thing, okay. Part B is not about direct answers. They will not give you any direct answers in part B. There will be answer, but that answer will be in the form of paraphrased structure. So what is paraphrasing? So paraphrasing, which means same meaning from the paragraph, but that sentence structure will be entirely different. Okay, so that is the correct answer. Okay, so that's all about part B. Now we are moving to part A, a new material. So this is the material. Okay, so this is part A, new material. It is 𝐶 chorea. Okay, 𝐶 chorea, that is the material. Okay, so about part A. What do you know about part A? All live, yes, every live sessions are revisions for you, right? Yes. So today also we are going to revise everything regarding part A. So what is part A? What is the connection, or what can be attributed, okay, to part A and your day-to-day activities in a foreign country? So what is part A? What is the connection? Okay, so we need to answer part A because if you guys are working in a foreign hospital, you should know about a lot of procedures, right? So if you don't know how to do a particular procedure, then it will be very difficult for you to survive in your profession. Okay, so locating answers from the given material or from the given maybe soft copy or hard copy, whatever it is important. Okay, so how can we locate the answers? If you want to locate your answer, you should practice a lot of part A materials. So that is why we are providing every day a lot of part A materials in front of you. Okay, so yes. So what about part A? Part A is all about, as I already informed earlier, locating answers. And here we have entirely 4 different texts. Text A, text B, text C and text D. Okay, and one of the texts will be a pictorial. Clear? So that is all about a structure of part A. Then what method we are applying here, what technique we are applying? I can say skimming and scanning will help you to find out or locate your answers. So what is skimming and scanning? Skimming, which means fast reading, and scanning, which means we are selecting or we are choosing, we are identifying, searching some important words, keywords from the text. Okay? Yes. Then, what about the number of questions? So, you have 20 questions in total and you can complete this 20 questions within 15 minutes. Actually, you don't need this 15 minutes to complete 20 questions. With practice, with a lot of practice, it will be very easy for you to finish part A within 8 minutes. Okay, so for that, Again and again I'm repeating the same thing. It is very important to do a lot of additional materials daily. Okay, now let's move to the question patterns. So these questions can be categorized into three different types. Okay, 20 questions as I mentioned, 1 to 7 which can be called match the following, and 8 to 14 set of questions that can be called short answer questions, and the rest of the questions which are called fill in the blanks questions. Okay, so yes, coming back to the strategy, skimming and scanning. So what is skimming and scanning? Yes, fast reading and searching for the words. So what kind of words that you will search? What kind of words that you will mark? So what kind of words? So please comment what type of words or what are your keywords. What do you know about those kind of keywords? Yes. Any idea? I know that you have a set of keywords, right? 13 keywords as I already told you from the previous live sessions. So definitely you know how to mark the keywords. So what are the 13 keywords? Okay, Reba, 15 minutes for 20 questions, skimming and scanning method. Very good, dear. Yes, you guys are updated, right? Yes. Hi, Ammo. Yes, how are you, dear? Yes, I'm good. Yes, Mega, skimming and scanning. Yes, Tessie, fast reading. Yes, Mega, 20 questions. Okay. Yes. Okay, Kochu. Yes. Heading, subheading, numbers, signs, symbols, names, time, abbreviations, experiments, research, bullet points. Very good. Very good. Yes. Brackets. Okay. Then numbers, signs and symbols, headings, subheadings, all the signs and symbols. Yes. Okay, Ansu. Heading, subheading. What about the rest? Okay. Okay, dear. Okay. So happy to hear that. Okay, Ammo. Yes. Finally. What about the keywords? So the first one is you can mark all the title, or I can say heading. So what do you mean by heading? Okay, in each and every text maybe they will mention the heading, sometimes they will not mention the heading. So whatever, if it is mentioned, you can mark all the headings from each of the text. Second one is subheadings. Okay, third one, numbers. Maybe numbers will be figures. Okay, 1, 2, 3, the numbers, figures will be there, and sometimes words can indicate the numbers. For example, what? TEN, 10. So that is a word, but it indicates a number. Then fourth one, signs and symbols. Okay, what is signs and symbols? Sign, all the sign. So equal to is actually a sign. Okay, greater than is a sign, less than is a sign. So likewise you can mark all the sign. And what are symbols? Percentage is a symbol, right? So likewise mark all the signs and symbols. And what about the fifth one? Names. So what do you mean by names? Pronouns, right? Maybe name of a disease condition, symptoms mentioned, and what about the name of a country mentioned, a name of a person. Okay, likewise you can mark all the names. Sixth one, all the short forms, abbreviations. Okay, maybe abbreviations mentioned here, so you can mark all the abbreviations. And what about the seventh one? Brackets. Okay, brackets are very important. Definitely they will ask you questions from brackets. And what about eighth one? It's all about italicized or bold letters. Definitely we will notice, right? That italicized or bold words or letters, definitely we will notice, but still it is very important to mark them. And ninth one, the words that can indicate time. Okay, a lot of words you know that will indicate time, because when you answer short answer questions, okay, if you are marking these time showing words from the test, definitely it's gonna help you. Sometimes they will ask questions starting with when. Okay, so likewise it is very important. You have to know, you have a clear comprehension regarding the time indicating words. Then the next one, the words that indicate experiments. Okay, like clinic, observations, diagnosis, ascertaining, identification. So likewise all the words that indicate experiment. Then the words that indicate research, and all the first and last line of each and every paragraph, as well as the bullet points. So this is how you guys are gonna practice it daily. So when you take apart a material, you should do that material in this way. Just skim and underline all these 13 keywords from each of the text. I hope it is clear, right? Yes. Coming back to the session. Yes, so what is the first question? So yes, this is text A. So what is mentioned? What are the keywords from text A? So may I know what are your keywords from text A? What are your keywords from text A? Let me know in the comments. There is no title, there is no subheading. So it's just starting with a paragraph, right? Almost 3 paragraphs, yes. So what are the keywords? Okay, so I'm just marking the keywords. I'm skimming the text and I'm marking the keywords. So my keywords, okay. In severe cases, these movements disturb daily life. Then synonym chorea, then strep throat, rheumatic fever, AFAB, as well as the full form also, the numbers. Okay. So these are my keywords from text A. So likewise, you can read it quickly, quick reading, and then you can mark some words from the text. Second one. So we have a title here. So I'm just marking the title. Then again, all the abbreviations, a lot of medical terms mentioned here, name of medicines, as well as, okay, some tests mentioned here, and I'm marking everything. Yes, so these are my keywords from text B. I just, okay, gave a glance into this. So these are my keywords. And from text C, a lot of numbers mentioned, 12, 4, 6, 1, a lot of numbers. Then follow up, which indicates research. Okay, then confirmation, cardiatitis, yes. Okay, from text D, yes, medication, antibodies, and necessary, severe symptoms, steroids, then drugs. Then synonym chorea, anticonvulsants, antipsychotics, dopamine depleters, tetrabenazine, yes. Group A, AB, hematologic, WHO, 12, SD, diagnosed, pharyngeal infection. So these are my keywords from each of the text. And now I am moving to the first question. So what is mentioned here? You can find out your answers from whether it is A, B, C or D. Okay, and it can repeat, the letter can repeat. First question, the instance that strongly demands the execution of brain MRI. So where this term MRI mentioned? So my keywords, strongly, execution, then MRI. Okay, so this particular terms mentioned, as we know, it is mentioned in text B, right? MRI, CT scan, everything. So directly my answer is option B. Okay, Tessie, B. Reba, yes, very good, Juby, it is B. Second question. The group of people seldom affected by synonym chorea, that is group seldom, which means they are not affected. Then synonym chorea, my answer is from, okay, it's all about the prevalence. So in text A, they have mentioned about the prevalence in the last one. So see the last one, last line, synonym chorea rarely affects children. Okay, so my answer is from text A. Yes, very good. Yes, Tessie, Reba, Sony, very good, text A. Third question, how many patients, they need a number, okay. Patients have synonym chorea with carditis in the study group. So as I know, carditis and study group, which is mentioned in text C, as you can see here, this particular box. So my answer is from text C. Okay, then the fourth one, the best management. So where they have mentioned the management, antibodies, everything, and that is in text D, all about the management. Fifth one, who are the better candidates to receive antibiotic prophylaxis? Again antibiotic, that is from text D. Sixth one, the conditions caused by a beta hemolytic streptococcus other than Sydenham chorea. So where is it mentioned? It is mentioned here, see, already we have read that. So that is from text A. Okay. So my answer is text A. And what about the seventh one? What all tests shall be included in the routine blood test to confirm Sydenham chorea? So about routine blood test they are asking. So your answer is all the tests mentioned in text B. Okay, regarding the blood test, everything which is mentioned in text B, it's all about the diagnosis, right? So our answer is all about text B. Okay, so you don't have to wait a single time. So whatever the keywords that you are getting or catching from the question, just find out your answer. Okay, so barely I take almost how much minutes? I can say maybe 3 or 4 minutes to complete this one. Okay, so now we are moving to the next set of questions, that is 8 to 14 short answer questions. You can write it in a word or a short phrase, which means maximum 3 words. Okay, Ammu, Reba, very good. Excellent. 7 out of 7. Okay, definitely. Yes. Then 8th one. Which is the antipsychotic drug? So definitely antipsychotic which is mentioned in text. Which text? Text D. The management is from text D. Okay. So we know that answer will be from text D. Drug that treats tics and outbursts. So what is your answer? Yes, that answer is haloperidol. So where is it mentioned? That haloperidol which is mentioned from text D. Okay, so where is it mentioned? Haloperidol. So that is mentioned in that is one of the antipsychotics which is mentioned here. Haloperidol control tics and outbursts, right? Okay, Alfie, it is haloperidol. Yes. Nasiraj, Sudha, yes. Jansi, okay. Okay, Ammu, Reshma, Anu. Okay, it is haloperidol. Very good, very good. Then the next question. The depletion of which vitamin can lead to the development of chorea in children? Okay, so depletion of which vitamin? Where is it mentioned, the vitamin? Which vitamin is mentioned? B12 deficiency in children can lead to chorea. So that answer is B12. Okay, B12 should be the answer. Yes, answer is B12 from text B. Okay, then 10th one. Which assessment? So always answer to the question when it comes to short answer questions. Definitely majority of the questions will be like what, which, when, why, procedure, name of the procedure, which method, which assessment. So likewise, always answer to the question. Which assessment technique might be employed to evaluate the presence of carditis in patients with Sydenham chorea? So carditis, then which assessment? Technique. Okay, so which technique? Any idea which technique? Okay, Kirtu, your score is 6, right? Okay, it's not a problem, dear. Definitely tomorrow you can score 7 out of 7. Okay, trust me. Yeah, what about 10th one? It is echocardiograms. Yes, which is mentioned here in text B, as you can see here, second paragraph, right? Echocardiograms are indicated to evaluate your carditis as up to 80% of patients with Sydenham chorea. So answer is echocardiograms. Don't put a comma or anything in between, okay, space or anything in between. It is a single word, echocardiograms. So that answer should be echocardiograms. Yes. Okay. Then the next one, 11th one. The kind of carditis seen in 9 of the patients with Sydenham chorea. So what is your answer? It is seen in 9 patients. So the numbers, it is mentioned here, 9 patients. So what is 9 patients? That is silent carditis. So answer should be silent carditis. See, carditis is already mentioned here. So you can write silent. Okay, so the term is already mentioned in the question. You don't have to repeat any words from the question into your answer option. So your answer should be silent from text C. Then 12th one, which gender is more likely to be affected by synonym chorea? So yes, which gender? Which gender? So that is mentioned here in text A. What is the gender mentioned here? Assigned female at birth. So it is more common in people, assigned female at birth. So whether you can write the abbreviation AAFAB or you can write the full form, assigned female at birth. Okay, so that is correct. So don't write female, okay, because very clearly in the paragraph they have mentioned about the particular term of the gender. So we can write not all females, okay, assigned females. So you can write female, it is assigned female. So answer is assigned female at birth, AFAB. Okay, don't write female, it is wrong. Okay, next one, 13th one. What can eventually be treated with administration of dopamine depleters? So dopamine depleters, which is mentioned in text D, as you can see. So answer should be involuntary movements. Okay, so that is the correct answer, involuntary movements. So we are using dopamine depleters to treat involuntary movements. So answer is involuntary movements. Okay, 14th one, the group of bacteria that causes synonym chorea in children. So what is the name of the bacteria? That name is mentioned here about, in the explanation of that particular disease condition. So the name of the bacteria is A-beta hemolytic streptococcus. So this is the correct answer. Okay, you should write this one, A-beta hemolytic streptococcus. So when you write that answer, that hyphen should be there, A-beta hemolytic streptococcus. Yes. So that is the end of 14th one. Then 15th one, same instruction, write it in a word or a short phrase, which means maximum 3 words. 15th one, the new onset of chorea in adults may indicate a structural basal ganglia pathology, especially in the dash. Especially in what? Any idea? What is your answer? Especially in what? Answer should be striatum. Yes. Okay, Sony, you got 12 out of 14, right? Okay. Yes, striatum should be the answer. And where is it mentioned? In which text? So that is from the diagnosis, right? Okay, so the new onset of chorea in adults. So those are the keywords from the question. May indicate a structural basal ganglia pathology, especially in the striatum. So answer should be striatum from text B. Yes. Then 16th one, valproic acid and carbamazepine are anticonvulsants that help by stabilizing dash. So anticonvulsants, it is definitely mentioned in text D. Okay, so what about anticonvulsants mentioned here? These drugs help by stabilizing nerve impulses. So what is your answer? Answer should be nerve impulses. So which is from text B, text D. Then the next question, 17th one, people who develop synonym chorea usually get it in childhood after having strep throat or dash or what? Okay, again it is the disease condition. So second line, it is the same bacteria that causes strep throat and rheumatic fever. So answer should be, again that same thing is mentioned here in this one. People who develop synonym chorea usually get it in childhood after having strep throat or rheumatic fever. So answer should be rheumatic fever from text A. Then 18th one, once synonym chorea is diagnosed, dash is indicated to decrease the risk of neurologic and cardiac problems with future streptococcal infections. So what we have to do? Okay, so that is all about the management they are asking. What do we have to do? So that is secondary antibiotic prophylaxis. Okay, so where is it mentioned about that? So see, secondary antibiotic prophylaxis should be used to indicate to decrease the risk of neurologic and cardiac problems with future streptococcal infection. So that answer should be secondary antibiotic prophylaxis. Okay, so the last 19th one, the patients who have carditis with dash are 19 in number. So what about that? Definitely in the study. Then search for the number 19. So where is number 19 mentioned? Okay, so answer should be yes. Carditis already mentioned in the question. Answer is pathological murmur. So answer should be pathological murmur. Yes. And the last question. PT scans and dash have demonstrated hypermetabolism and hyperperfusion of the basal ganglia in case reports. So what is your answer? PT scans and dash. What is it? What is your answer for the last question? Question number 20. Okay. From the diagnosis. Yes, Soumya, very good. SPECT imaging. Okay, answer should be SPECT imaging from text B, the last paragraph. See, PT scans and dash. SPECT imaging. So answer should be SPECT imaging. Have demonstrated hypermetabolism and hyperperfusion of the basal ganglia in case report. So answer should be SPECT imaging. Clear? Yes. So that's all about today's session. Okay, so as I mentioned in the beginning, please do additional materials daily. If you want to crack this exam, please do additional materials daily. And if you have any doubts regarding the session, any doubts regarding the classes, anything, you can contact on the number which is mentioned on the screen. So that's that. Happy weekend. Thank you.